Again, I'm Joanna Cazden. I'm from Los Angeles. I work at Cedars-Sinai half-time, and I do some private work, including on Skype. So if you have follow-up things after this symposium day, you can go to joannacazden.com and find ways to communicate with me further. One of the things that I noticed last night as I was listening to people's stories was a predominance of relatively shallow, small breathing. And immediately some of you have thought, oh, I must have been doing something wrong. There's something wrong with my breathing. And I'm not using the word shallow in a negative or judgmental sense. It was more of an observation, a description. I think that shallow breathing can be a management strategy when the voice is in trouble. It can be a compensation, it can be an unconscious thing, it can relate to depression, shame, the general sense of withdrawal from the world, which can go along with these disorders. But I have already, just in the hours that we've been together, begun to realize that perhaps there is a dystonia that's affecting the respiratory system as well. And I've already spoken to a couple of people who say, yeah, I try to take a deep breath, and that feels spasmodic too. So that might be a whole nother area of investigation that's wide open. The main point now is that if you're observing your breath, or if you're doing things that I suggest in terms of exercises, and it doesn't seem to work for you, don't go into the judgment, there's something wrong with me, frame of mind. The best attitude toward our bodies in general is of loving curiosity. That is to simply observe what's happening. Sometimes that attitude by itself, loving curiosity, sometimes that triggers a change. But at least it gives us information without that extra overlay. We're in a culture that denigrates the body and tries to control and manage and criticize the body. And my orientation is the exact opposite of that, which is of integrating and accepting the body and the mind together. And breath is often, but not always, a good tool for doing that. I want to mention a couple of cases, particular cases of people that I saw who had more of a muscle tension component than spasmodic dysphonia, but where breathing turned out to be key to the onset of the disorder when we got into it. So this is where I'm addressing breath as part of the assessment process. There was one patient who came in with really almost no voice, and she had been like this for about a year. It turned out as we got acquainted and tried different things and discussed and so on, she had a gastric bypass with complications and repeated surgeries to her abdomen with adhesions and discomforts and numbness inside. And by the time I saw her, her diaphragm was simply not functioning. So that would mean that there's very little breath pressure getting to the vocal cords and they were going to shut down. We did find some very tricky ways for her to pay attention and get in touch with her breath. But rather than blaming what was going on here, it was actually seeming to start here. Another gentleman with a very similar presentation had had repeated colon surgeries. So again, if this area is disrupted anatomically or mechanically, that's going to affect what happens further up. So I think it's helpful for clinicians and for those of you dealing with these disorders to be aware that other changes in the whole body can affect what happens in the larynx, and this becomes important as we decide how to proceed with treatment. If all breathing movements are available and the body in its wisdom has multiple ways to breathe, the rib cage can work primarily at the top, it can move forward, it can move sideways, the diaphragm can move down, and there can be any combination of those things. There are various ways to exhale by controlling the ribs, by pushing more out, by squeezing. Some are more effective than others, but again, the body has lots of redundancy because breathing is so important to our survival. So if various things are available but not being used, those can be addressed in therapy through training and can improve what happens once the airflow gets to the vocal cords, which is sort of where the rubber meets the road and where the vibration capability begins. So that is all discussing breath as a mechanical thing, as the driving force for breath. There's another general reason why breath can be a useful tool in managing these disorders, and that is because of the connections between breathing and emotion. Now, we've discussed already this morning that spasmodic dysphonia is not caused by our psychological state, by hysteria, or anything like that. However, it is known that symptoms become worse in the presence of anxiety. So that if you know you're going to have trouble answering the phone, when the phone rings, your voice will probably get worse than it was 5 minutes before that. And so learning how to manage anxiety and becoming an expert at managing anxiety may often involve managing the breath, because of how learning relaxed breathing can help to dial down some of those more psychological symptoms. Is that distinction clear? So you're almost becoming an expert in managing breath in order to manage anxiety, because that's one way of managing your symptoms. Doesn't mean that you were crazy to begin with, it just means that you're going to become a super good user of breath as part of your symptom management. I think it's also very important, and I'm not sure if there are any other speech therapists in the room, but I'm a big believer in breath training for clinicians. There is more and more evidence that the kind of mind-body practices that include breath management, Tai Chi, yoga, getting regular massage, these kinds of things, change the presence that I as a clinician will bring into the room and my ability to hear and understand you as a patient. So whatever I'm recommending for people who are dealing with a disorder, I think is equally important for those of us on this other side of the table, because it affects our ability to be present, to practice our own loving curiosity towards our patients, rather than coming in, what can I fix, what are you doing wrong, and that kind of attitude, which can be so off-putting and unsafe. Let me get a little more specific about the kinds of adjustments for different kinds of disorders. With adductor symptoms, the cords as they spasm are coming too close together and interrupting breath. So often therapy will focus on increasing the sense of breath, increasing the amount of air that's passing through, and making sure that some of these larger breathing muscles are doing that regulation work for the breath, so that the vocal cords don't have to be working as airway regulators, which they can and will do. I'll talk more about that in a moment. With abductor symptoms, there's too much breathiness and people are running out of breath suddenly or unexpectedly. And so there we're focusing again on smoothness, but a smoothness with a smaller aperture, and learning to use probably a little less air, which encourages the cords to come a little closer together and to stay together more consistently. With both of those, and with the mixed form, we as speech therapists may fall back into some of our training in phonetics, because airflow is different, as you may have discovered, between vowels and certain consonants, especially T, P, S, H, things like that. So we pay a lot of attention to the changeover between a consonant and a vowel, and how the breath is being managed right at that micro level, as well as we might be training a sort of bigger whole body approach to the breath. So we sort of have this big picture, but we also get in real detail inside syllables and in between letters. And if there's difficult consonants in someone's name, telephone number, address, the basic information that you're giving frequently, that would be an especial target to practice and get some strategies for. With the muscle tension component, which may be mixed in with the spasmodic conditions, we especially want to reduce the larynx's role in regulating airflow. The vocal cords are part of the airway system, and generally they know it. There are sensitive receptors at different levels of the brainstem and the midbrain and the stretch receptors in the lungs. So the vocal cords have a pretty good idea of what the breath is doing. We think that in spasmodic conditions, some of that communication may break down. Some of that crosstalk within the brainstem may break down. But under normal conditions, the vocal folds are very good at regulating airflow, and they will do it if nobody else is doing the job. In order to unload or take pressure away from the larynx, that's when we want to be training the bigger breathing muscles so that they are sort of picking up what should be their job of regulating airflow. And often then the larynx will tend to relax and do the job that we prefer, which is simply to flap in the breeze and vibrate on an airstream that's being provided for it. Okay, enough of theory. If everybody could stand up, please. We'll do a couple of quick demo exercises. And these are things that simply increase your freedom, your awareness of breath, and maybe a few new discoveries about how you might be able to breathe. So just begin with a little bit of circular movement with the head. Think about drawing something, if you had a sheet of glass in front of you with some steam, and you were just sort of writing letters and numbers or circles. So we're pivoting at the very top of the spine, and these can be small or large. Some of my training in the mind-body says that we tune in most easily moving from the top of the body downward. So we're going to start with the very top of the neck. Okay, and let that come to rest, but invite the back part of your neck to be a little longer than it was before. So your ears are over your body, not in front of it, and maybe a little further away from the shoulders than before. Okay, now just bounce your arms and shoulders. And while you're doing this, just check that your knees are soft, and you could bounce a little bit in your knees if you want. This is not elbow stuff. This is shoulder, okay? And a little bit of a shimmy and shake, and the whole little hokey pokey is okay for the rest of the body as well. Okay. Grab your arms, and I've sort of got one wrist this way. You can do it this way if you prefer. And pull down and forward. This is going to allow your shoulders to roll quite far forward. And imagine that there's a beach ball right in the middle of your upper back. You know that spot where you always want the hot shower to hit? That's where I want you to imagine a beach ball. And as you inhale, you're going to blow it up. And as you exhale, you're going to stretch a little bit further, kind of separating your shoulder blades, pulling the elbows forward and down. We're going to do that one more time, inhaling into the upper back, filling up that beach ball, exhaling, pulling the arms down and forward. Okay, release that, shake out a little bit, and we'll do the reverse. So now you're going to pull your arms down behind you. And now the beach ball is right up in the front of your chest, right in the heart area. So as you inhale, you're going to expand as if you're really almost stretching your collarbones apart from each other. This is the very upper part of the rib cage. As you exhale, you pull your arms a little bit further away, shoulders sliding down and behind you. One more time, inhaling deeply in and exhaling, stretching. Under normal circumstances, I would repeat that combination, going back and forth a few times. But even just with that little bit, you might feel a little more space in here. And for anybody who's thinking, oh, but I've been told never to breathe into my chest, wrong. The front of the chest is great. The back of the chest is great. It's the up and down movement of the chest that we consider inefficient. It involves neck muscles that aren't really good at controlling breath. But a sense of expansion around the heart, front, sides, or back usually feels good, and it works just fine, and opera singers are instructed specifically to do it. So take that off your list of no-nos. Okay, just a couple more. Lift up one arm and give yourself a side stretch. So you're reaching your fingertips to the opposite wall while keeping that hip and leg quite heavy. So the hip and leg on the same side as you're stretching, you're wanting to keep that kind of anchored, and so you get a stretch into the side here. You might have done this in a dance or a yoga class. And while we're here, just explore pulling the shoulder down and get a little more isolation right there, and bring that arm down. Of course, don't do any of this if it's bad for you. You know your own limitations of shoulder or elbow injuries or whatever. Okay, other side, reaching up, reaching over, inhaling to stretch, allowing and inviting that side of the rib cage to stretch. You may find your stretch is very different one side than the other. I've got a pretty corkscrew spine myself. And again, you want the leg on that side to feel heavy. So the hip is anchored, pulling away from where that shoulder and things are stretching. And now, as you go back to your shimmy shake, you might have a little more sensation of where the sides of your ribs are. And possibly, if you invite a little more expansion into the sides of the ribs, you're getting more information into your brain about where those areas are, and maybe a little more freedom. Having done all that, you might also notice that you've got a little more awareness of belly breath also. Simply loosening up the top part gives us more access to the bottom. These kinds of stretches, yoga practices, dance, anything that increases range of motion and freedom of expression in these areas is going to be helpful for your breath. And I'm racing because of time, so one more big shimmy shake. Lifting both arms up, reach all the way up, again with some grounding in your legs and hips, soft knees, drop the shoulders, feel how much wider your back feels. Bring the arms out, stretch them to the far walls, as if your elbows could sort of pull your ribs open a little bit further. And then see if you can keep that sense of expansion as the arms come down. So that came back to a symmetrical pose, and there we are, and you can have a seat. Thank you. Let me sum up, and then we'll have a couple minutes for questions. I invite you to become an expert in your own breath system. Every body has its preferred way to breathe. Even with singers, some do better with a high rib cage, some do better with a lower control and more diaphragmatic action. The abdomen can work. It doesn't always work well, but there are some different abdominal muscles that can be engaged. Everybody's got a different rhythm of breath, a different phrase length that you're trying to match the breath to. So become an expert in what works best for you. Always looking for freedom and options before you try to figure out what's correct. Because if you figure out what's correct first, you're going to put that on top of a system that's already constrained. So you want to kind of open up and clear the decks first, and then see if there's something a little bit more useful than what you were doing before. The best modality for you may not be the same as for somebody else. Some people really benefit from this kind of movement-based exercise that we've been doing. Others may do better with a very quiet, image-based visualization process. That can affect your breathing just as much. And for stress management and anxiety, those meditative processes are extremely helpful. Other people may do best really focusing on tiny moments of phonation. Exactly, as I said, where the breath hits the vocal cords and how to get a clean onset, either from a dead start or after a consonant. That might be different from one vowel to another, and your favorite vowel might be different than somebody else's. But these are the kinds of things that you can explore working with a speech therapist that is really a specialist in voice disorders. And no, most speech therapists are not. We're a tiny subset. But those of us who are specialists, we really love working on it. So we'll get into all of those details with you. And finally, if you discover that you're doing some of these explorations and things still feel kind of stuck and spasmodic, let your doctor know, let the researchers know. There might be a whole new area of dystonia that's affecting the voice that might start somewhere down here. And I would love to learn more about that. So we've got a few minutes for questions before I turn things over to Sarah. Yes, ma'am.
I have two.
Yes.
Are there any acupressure points that will reduce stress? And secondly, are there any exercises we can do in the car?
Acupressure, there probably are some wonderful tools there, but I know very little about it. I have received acupressure, but I don't generally do it. But it's a great question to ask. As to what to do in the car, I think the simplest thing is to slow down your exhalation, to become mindful of your breath rhythm and make the exhale longer than the inhale. And that has which might mean taking a slightly larger breath than you're used to. That has two benefits. One is that it activates the parasympathetic system and will reduce stress and anxiety. And given that when we're driving, there are often moments of overexcitation, learning how to relax on the road is a good thing. But the prolonged exhalation is also what we need for speech. So whereas most relaxation techniques will have an equal slow inhale, slow exhale, when we're talking, we need a fast inhale and then a prolonged exhale. So playing with that rhythmic change would be something that you can do quite safely in the car without moving or wiggling around very much.
One last.
Yes.
What about hard swallows? Is that good?
That is a technique that I use for other things, like interrupting throat clearing and so on. I'm not sure how much effect it would have on your breath flow, other than stopping it quite firmly for that moment. Other questions? Yes?
Is there a better period of time during the day to do these exercises? And if there is, should they be done frequently, or sometimes you have a tendency to overdo it if you think, well, boy, this is really helping me or not doing so well?
Right. In terms of time of day, that's probably quite individual. Earlier in the day is probably a better time for the energizing type, movement-oriented things. But sometimes, you know, if you've been stuck in an office cubicle and then a car commuting most of the day, you might want to do some more vigorous stuff later in the day. Certainly meditation and the slower breath practices are helpful before sleep. But otherwise, you know, I think it has to do with getting to know your own cycles of energy or not. I think that when you're learning techniques, probably setting aside at least half an hour at a time, 40 minutes or an hour, for instance, to take a class, is good because it gives you a deeper chance to experience something. I don't like to do half-hour sessions with people because I need that time to really tune in and get into the complexities of that body-mind. But once you have learned something and you've got a sense of, oh, I can activate my diaphragm in a new way, I would absolutely practice it in tiny little bits all the way through the day, because the nervous system will learn and reinforce it that way, and it will integrate better with your everyday activities. Yes, ma'am.
I've been told that I have a compensation of speech
Well, that would probably take a detailed process with a trained therapist. I did not hear that happening as you just spoke to me, unless my ears and eyes are way off. Okay, well, then you already know how to make the change. And I would, again, practice loving curiosity. What makes it easier for you to make the change? What are the situations where it's harder? And do some discovery that way. But it might also be very helpful for you to work with a trained voice therapist. Yes, ma'am.
My husband has a great deal of trouble with the roto system, calling a number and ordering all the initial mechanical. They have no idea what he's saying. Once he reaches an operator, then it's okay. Any suggestions for?
Well, what type of SD is he coping with?
That's a good question.
Okay, so maybe some of each. Again, that's going to take some detailed troubleshooting. I wouldn't want to venture. Other than to reduce the breathiness of those particular consonants, S, T, P, and H, which are usually the worst offenders. So make the S more of a Z, make the T more of a D, make the P more of a B, and diminish the H. And that will reduce the extra puff of air that happens right then, and might keep the chords functioning a little bit better without a great loss of intelligibility. Okay, I'm going to close up in the interest of time. I will be around after these sessions and look forward to talking to you more. Thank you very much.